Good evening and welcome. Coming to you from South Africa, let's take a look at the top story that we are tracking for you. Now, India continues to record alarming number of COVID-19 cases every day. The country has reported 273,810 fresh COVID-19 cases in the last 24 hours. India registered the biggest spike ever yet again. Now, the latest spike has taken India's COVID caseload past 15 million. India continues to be the second worst affected country due to COVID-19 after the United States. 1,619 people have lost their lives in the last 24 hours. India's total death toll has crossed 178,000. Now, Indian Prime Minister Narendra Modi is currently chairing a high-level meeting regarding the worsening COVID-19 situation in the country. The national capital of Delhi will go under complete lockdown for 1 week. Delhi Chief Minister Arvind Kejriwal has said that the health infrastructure is at its breaking point. Now, the decision comes as Delhi registers the highest number of cases ever in one day. That is 25,462. Delhi has a positivity rate of 30%. Now, this means that every third person being tested is positive for COVID-19. On the national level, 1 in 6 people are testing positive for COVID-19. The second wave of COVID infections has crippled India's health infrastructure like never before. Arvind Kejriwal has urged the central government to provide more hospital beds. On Sunday, less than 100 critical care beds were available in a city of more than 20 million people. The city is also running out of oxygen cylinders and medicines required to treat COVID patients. Kumbh festivities come to an end after Prime Minister Narendra Modi said that the festival should be symbolic. Now, Delhi authorities have said that the seers returning will have to quarantine for 2 weeks. 3,700 people have tested positive in the city of Haridwar amid the Kumbh festivities. The RT-PCR tests in India are failing to detect whether a person is infected or not. Now, let's try to understand why many people are receiving false negative COVID reports. The virus that it was designed to detect has now changed its behavior. The mutated strain does not colonize in the nasal or throat cavity, and people collecting swabs are not well trained. There is an improper and delayed transport of the samples to testing facilities. Now, how is the new strain of the virus different from the previous one? The new variant has a social mutation. These mutations allow the virus to gain entry more easily and it multiplies faster. Now, the mutation might make it more difficult for the immune system to recognize the virus due to its different characteristics. And it has also been found that the new variant has the ability to surpass the immune system and is highly resistant to antibodies.